Elizabeth, and I am doing a health assessment for GI, musculoskeletal, and neuro. Video number 2 for advanced health assessment. This is Douglas. I'm going to start by observing him and his appearance. He is overall well kempt, dressed appropriately for the weather. His skin color is consistent with his ethnicity. Mood is good. He's alert and making eye contact. And now we're going to start with the GI portion of the exam. So we're going to start with the GI portion. The patient will be laying down. I'm going to ask him to pull his shirt up to just below his breastbone, and I'm going to start by inspecting his abdomen. It appears symmetrical, no signs of distension, no signs of peristalsis, no ecchymosis, no visible lesions. Everything looks good. So now I'm going to move on to auscultation. I am going to start in the right lower quadrant. And I would usually listen for 3 to 5 minutes. For the sake of this video, I will be listening for a much shorter period of time. And I am listening for normal active vowel sounds. The right lower, right upper, left upper, left lower. Vowel sounds are normal active every 5 to 35 seconds. I'm going to move on to listening to the vessels in his abdomen. Starting with his aorta, I'm listening for any bruit. No bruit noted. I'm going to move on to the renal arteries. Start on the right, and the left, and move down to the iliac, right, and left. Or not iliac, inguinal. Okay, no bruits noted. Now we're going to move on to percussion. I'm listening for resonance. I'm going to start in the right lower, left upper. Okay, everything's resonant. I'm going to lift up the t-shirt a little bit more. I am going to assess the liver. I'm going to percuss from the bottom until I get to the liver's edge where I should hear dullness. So start from down here. Right on here we have dullness. I'm going to start from the top. Okay, and we have about 6 centimeters, which is within normal limits. And then I'm going to percuss for splenomegaly, or just the spleen in general. And that is kind of mid-axillary anteriorly, right below the costal margin. And I'm just making sure that we have no splenomegaly. Okay, no dullness noted. And now I'm going to move on to palpitation. I'm going to start with light palpitation. Please tell me if you have any tenderness. I'm moving through all 4 quadrants. Any tenderness at all?
No tenderness.
And I'm going to move on to deep palpitation. Please let me know if there's any tenderness. I'm feeling for any masses, any abnormalities. Again, moving through all 4 quadrants. Now I'm going to palpate for the liver. So I'm going to ask you to take a deep breath and let it out. I'm just palpating for the edge of the liver. Okay, now I'm going to move on and I'm going to palpate for the spleen. Again, take a deep breath, let it out. And I am just feeling, see if I feel anything abnormal below the ribs. I don't, which is good, that's within normal limits. I'm going to palpate for the kidneys. Should not feel them. I do not feel the right side. I'm going to go to the left. Don't feel anything, and now I'm going to palpate the aorta. I'm feeling for a thrill. I don't feel anything. Should be a little to the left of the umbilicus. Feeling for the borders on each side. And it's about 3 centimeters, which is within normal limits. Okay, so now we're going to move on to this musculoskeletal portion of the exam. First, I am going to inspect, I am looking at the upper extremities to begin with. laterally, which I'm observing, with no winging, so no signs of dislocation. Are you having any pain, anything like that?
No.
Okay, good. So now I am going to, no swelling, no edema noted. Now I'm going to move on to palpation. And I'm going to start by palpating his clavicles, then for any nodules, any masses, anything irregular. Please tell me if you feel any tenderness. I'm feeling the shoulders, the sternoclavicular joint, AC joint. So now I'm feeling your acromion processes. Is there any tenderness?
No.
Okay, so then we'll move on to range of motion of your head and neck. We'll start with flexion of the neck. So I'm going to have you move your chin to your chest. Excellent. Move back up. Any tenderness when you do that?
No.
Okay, let's go 45 degrees. Now for an extension, I'm going to have you move your head as far back as you can go. Good. Move back up. That is about 45 degrees as well. Now we're going to do lateral bend on both sides. So move your right ear to your right shoulder. Okay. Now left ear to left shoulder. Perfect. It's about 40 degrees. And then we are going to do lateral rotation. So I'm going to have you move your head to look over your shoulder. Okay. Now the opposite side. Good. That's about 70 degrees, which is normal. And then we are going to check the strength of your neck. So I'm going to ask you to move your head to the right against the force of my hand. Good. Strength is good. +5. Other side. Try to look like you're looking over your shoulder again. Good. Okay. Strength is +5. And now we're going to move on to the range of motion of your shoulders. I'm going to have you extend your arms over your head. About 180 degrees. That is normal. Now I would like you to put your hands, bend your hands behind your shoulders. Good. About 90 degrees. Now move your arms and bend them behind your back. Perfect. Again, 90 degrees. And then I'm going to have you cross your arms in front of your body, touching your shoulders. Good. That is about 50 degrees, which is within normal limits as well. Next, we're going to test the strength of the shoulders. So I'm going to come around and I'm going to put my hands against your shoulders. And I want you to kind of shrug up against my shoulders. Okay, good. And release. Okay, so strength is 5 out of 5. No signs of fatigue. Everything is normal there. Was anything uncomfortable to you during that?
No.
Okay. And now we will move on to your elbows. I'm going to ask you to extend your elbows. 760 degrees. That's perfect. And I want you to flex your elbows. Good. That is about 90 degrees. And now I am going to have you put your arms out supine like this. And then prone like that. This is about 90 degrees. And that was 90 degrees, which is normal and into the normal limits for range of motion of the elbows. Now we're going to check the strength of your elbows. And now you put your elbows just like out like this. Okay, I want you to pull against my hands. Good. 5 + 5. Now push against them. Again, 5 out of 5. Strength. That is within normal limits. I didn't notice any fatigue. Nothing like that. Okay, so next we are going to test your reflexes. We're only going to do the left side for sake of time. I am going to start with the biceps. I'm going to press my thumb on the tendon, and I'm going to tap down. I'm observing for contraction of the bicep and the elbow, which I did feel, so that's 2 plus breathing. Next, I'm going to ask you to flex your arm. I'm going to tap your brachioradialis next, and I was observing for supination and flexion, which I did observe, so it's another 2 plus breathing. And then we are going to do the triceps. So I'm going to ask you to hold out your arm. I'm going to support your bicep while you let your lower arm dangle. And I am going to tap right here. And again, that is a 2 plus breathing. I was looking for extension of the arm and contraction of the tricep. And I would do this bilaterally usually, but again, for the sake of the video, I am not. Next, I'm going to palpate the radial and brachial pulses. So I am just going to feel here for your radial pulse. There's symmetrical, 2 plus. I'm going to move on to your brachial. Symmetrical, 2 plus. Easy to find. And now I'm going to inspect your hands and wrists. They are symmetrical bilaterally. I don't see any joint deformity, no unusual lesions. Do you have any pain in your hands?
No.
Okay, so now I am just opposite leg. So it's 20 to 30 degrees. That's within normal limits. And outward. Abduction. That is 40 degrees and normal. Okay. So I am going to assess the right leg. And I'm going to have you just lift your leg up. Straight. Well straight. Okay, good. That's about 30 degrees. That's within normal limits. You can release your leg. And normally I would assess both sides to verify that everything's symmetrical, but in the case of this video, we will only assess one side. Now we'll move on to the assessment of the lower extremities. And I'm going to start by inspecting. I'm looking for even hair distribution, symmetrical shape, no lesions, no ecchymosis, normal skin tone, no edema noted. And then I'm going to move on to palpation. I'm going to start at the femur. Please tell me if you feel any discomfort. They're smooth. I don't feel any masses. Now I'm moving on to the patella. Again, it's smooth. I don't feel any crepitus. No edema is noted. And do you have any tenderness here?
No.
Okay. Moving down to the tibia. Smooth. No masses. And I am moving posteriorly to feel the fibula. Smooth. No edema. And then I am palpating the talus. Normal limits, no edema. And the malleolus. Any tenderness?
No.
Okay. So all is within normal limits there. And I'm going to palpate the pedal pulses. Right here. And they are 2 plus within normal limits. And then I'm going to have any tenderness in your feet.
No.
No, good. Next we will do the range of motion of your feet and ankles. I'm going to have you do dorsiflexion, so move your toes towards your knees like that. Good. And now I'm going to have you do plantar flexion. Again, that is good. 45 degrees within normal limits. You can relax your feet. Now, press on my hands like a gas pedal. And on the side, good strength. Okay. Now I'm testing the ankle for any laxity that would indicate an injury. Good. Side 2. Discomfort.
No.
No. Okay. Can you flex your toes for me? Good. Alright, extend your legs. Good. Okay, now I'm going to have you lay back in supine position the other way. And I'm going to have you move one knee to the chest, then the other. Good. I don't assess any clicking, no popping, no unusual sounds. Everything's within normal limits. Any discomfort?
No.
No. Okay. Next we are going to test those reflexes. We're going to start with the patellar reflex. Standing right there. I'm looking for contraction and extension of the leg below the knee. And we're going to do this side. Okay, good. Good.
Mm-hmm.
Okay. Now we're going to move on to the Achilles tendon. Just relax your leg. Actually, I would like you to dorsiflex your foot up. Good. And we will be looking for plantar flex. Good. And on this side. Good. Alright. Okay, next we'll do the Babinski reflex. I'm going to put your foot out. We're only going to do the right side for sake of ease. Flex your foot a little bit. Good. Okay, and now I'm going to move the edge of my hammer up and around, and you'll see flexion of toes and dorsiflexion, which is a negative sign and to be expected in adults. If it was positive, the toes would flex and fan out, and that would be a positive sign, which is normal in children 2 years and below. Next, we're inspecting posture. I am looking at him standing up straight and inspecting for kyphosis, lordosis, scoliosis, pelvic tilt, which I do not observe, and I am also looking for symmetry of the shoulders, scapula, and hips and buttocks. All are symmetrical within normal limits. I would be inspecting the skin of the back as well. Now I am going to assess his range of motion. Can you please lean forward for me, touch your toes? I'm looking for about 90 degrees. Okay, that's within normal limits. You can stand up. And I don't see any spinal masses. There was no spinal deviation. And now I am going to ask you to lean back as far as you can. That's about 30 degrees. Okay, you can stand up straight now. Thank you. That was within normal limits. And that was extension. And now I'm going to ask you to lean to the right as far as you can. Okay, about 35 degrees. That's good. Other side. side, please. Again, 35 degrees, that's within normal limits. And then I am going to palpate the spinal column from the top all the way down, feeling for any abnormalities, any swelling. Asking if there's any tenderness.
No.
Okay. Everything's good, symmetrical. No masses, anything like that. And then that ends our musculoskeletal assessment. Now we're going to move on to testing the cranial nerves. I am going to start with cranial nerve 1. That is the olfactory nerve. I'm going to test your sense of smell. I'm going to ask you to close your eyes. And I am going to hold a scent below your nose, and you're going to tell me what you think it smells like. Take a deep whiff.
Eucalyptus.
That's right. Okay, you can open your eyes now. Olfactory nerve is intact. We'll move on to cranial nerve number 2, which is the optic nerve. We are going to start by testing your visual fields. So I'm going to ask you to cover one eye. I'm going to cover that same eye. And you're going to tell me when my hand comes into your plane of vision.
Mm-hmm. Yep. Yes.
Okay. Now we're going to test the other side.
Mm-hmm.
You just look at me.
Yeah. Yeah. Yes.
Okay. And cranial nerve number 2 is intact. And then I am going to move on to cranial nerves 3, 4, and 6. First, we're going to assess extraocular movement. So I am going to ask you to look straight ahead and just follow my fingers with your eyes, okay?
Mm-hmm.
So, looking for nystagmus, checking convergence. Good. There's no nystagmus, nothing unusual. He followed well. So cranial nerves 3, 4, and 6 are within normal limits. I'm also going to check his pupils. We're going to look for pearl. I'm going to ask you to look straight forward, and I am going to shine a light in your eyes. Okay. Pupils are equal, round, reactive to light. We are starting at cranial nerve 5 now. We are going to test his facial sensation. I'm going to ask you to keep your eyes closed, and I'm going to touch you with a soft or sharp sensation, and you are going to tell me if you feel soft or sharp, okay?
Yes.
Okay.
Soft. 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 Sharp. Soft. Sharp. Sharp. Sharp.
Okay, good. Now I'm going to ask you to open your eyes, and I want you to clench your jaw, and I'm going to palpate your masseter muscle. Good, and your temporal muscle. Also good. All right, cranial nerve 5 is intact. Can you blink for me? Good, so cranial nerves, the 3, 4, and 6 are intact. And now we're moving on to facial movement. Can you smile for me? Frown. Puff out your cheeks. Good. And cranial nerve 7 is intact. Then we are going to move on to cranial nerve 8. I'm going to assess your hearing, so I'm going to go behind you, and I'm going to whisper 3 words in each ear, and you're going to tell me what I said, okay?
Okay.
Okay, I'm standing a few feet behind you.
1, 2, 4.
Yes. Okay, now I'm going to go on the other side, cover that ear. Perfect.
A, Z, D.
Good. Okay, your hearing is within normal limits, and we are going to move on to cranial nerves 9 and 10. I am going to assess your palatal movement, so I'm going to ask you to open your mouth and say ah.
Ah.
Good. Okay, the uvula went up, palate went down, and I am going to ask you to swallow. Perfect. Now I am going to do cranial nerve 11, the trapezius and sternocleidomastoid. I am going to push down on your shoulders. I'm going to ask you to shrug. Shrug. Good. Okay, and strength is intact. He shrugged. That's within normal limits. Now we'll move on to cranial nerve 12. I'm going to ask you to stick out your tongue. Move it up. Move down. Side to side. And I am going to test your tongue strength. Move against my... Good. This side. Good. 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 Okay, and his hypoglossal nerve is within normal limits. And that concludes the cranial nerve exam. We will move on to the seated neuro exam. Okay, now we're going to start with the seated neurological exam. I'm going to ask you to do rapid arm movement, so I want you to do this as fast as you can. Good, okay, you can stop. Now we're going to move on to the heel to shin test. I want you to run your heel down your shin to your foot on both sides. I'm looking for smooth motion and straight line. It's accurate, good. And now we can move on to have you close your eyes for the next several exams. I am going to assess superficially pain, so I'm going to go up a dermatomal distribution, and I am going to just give you a sensation of sharp or dull all the way up, and I'm going to have you tell me whether or not it's sharp or dull, okay?
Okay.
All right, I'm going to start at the bottom and work my way up.
Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay, everything is within normal limits. And I'm going to do the same with temperature. I am going to do a hot and a cold, or warm water and cold. And again, your eyes are going to remain shut. And again, I'm going to do a dermatomal distribution. And that just indicate whether or not it's hot or cold, okay?
Okay. Hot. Cold. Cold. Hot. Hot. Cold. Hot. Hot. Cold.
Okay, good. Sensation is within normal limits. He's able to determine hot and cold accurately. And now we are going to move on to a vibratory sensation. I am going to grab my tuning fork, and I am going to ask you to open your hands now. And open your eyes now. And I'm going to ask you to let me know if you can feel the vibration sensation, okay?
Yes. 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 Yes.
Doing the toes as well.
Yes. Yes.
Okay, vibratory sensation is intact. Next, we're going to test proprioception. I'm going to ask you to close your eyes. I'm going to ask you to hold out your hands. And I want you to tell me whether or not I'm pushing your finger up or down, okay?
Mm-hmm. Up. Down. Up. Down.
Okay, your proprioception is intact. And now we are going to move on to cortical sensation. I'm going to put an object in your hand, and you are going to tell me what it is with your eyes closed, okay?
Mm-hmm.
Okay, hold out your hand.
Is that a marker? Highlighter?
Yes, that's correct. Good. Now I am going to do graphesthesia, or graphesthesia is intact, and now we are going to do stereognosis. Keep your eyes closed, put your hands out, palms up, and I'm going to draw something on your hand, and you're going to tell me what it is, okay?
Yes. Is that a heart? Or the 3?
It's a 3. Good. Okay, now this hand I'm going to...
A B?
That's correct. Excellent. Next, we're going to do 2-point discrimination. I'm going to ask you to close your eyes, and I'm going to ask you to tell me when you feel that there are 2 points touching you.
Two.
Okay. That's about 6 millimeters, which is within normal limits. So your 2-point discrimination is good. Now we're going to do extinction. I'm going to ask you to keep your eyes closed.
Okay.
And I am going to touch you on different sides of your body. And can you just tell me where I'm touching you?
On my hand? On my elbow?
Are you still touching your elbow?
No.
Okay, perfect. Extension is intact, and now we will move on to the standing portion of our neuro exam. Now we are going to do the standing portion of the neuro exam. I'm going to ask you to walk in a straight line to the camera and back again to your starting point. Kind of get to the hallway a little bit there. Good. Now I want you to walk on your heels. Okay, and back to the hallway on your heels. You're not going backwards. And now walk on your toes. And now I'm going to ask you to walk heel to toe. I am checking for balance, coordination, looking for any stiffness that might indicate any kind of cerebellar disease. Okay, I don't see any fatigue, and he seems coordinated. Now we're going to do the Romberg sign. So I'm just going to ask you to stand with your feet together. Together. Good. I'm looking for any swaying, any kind of off-balanceness. He is able to keep his balance, which is an appropriate finding. And then we're going to test for pronator drift. So I'm just going to ask you to put your hands straight out in front of you. And I am checking to see if either of the limbs are drifting downward. That may be indicative of a cerebrovascular event, any kind of CV disease. And it is within normal limits, no pronator drift. And that actually concludes our neurological assessment. Thank you.